Today we're looking at facial aging. What happens with facial aging? What is a natural appearance from facelift and neck lift surgery? Well, facial aging in women, in men, well, there are really three aspects of aging that affect all of us. Firstly, there's gravity, everything is always dropping. Secondly, there's volume loss. And thirdly, the skin gets looser. So what is so important in keeping people looking natural? In other words, avoiding like a done appearance. Hello, my name is Dr. Julian De Silva. I'm a board certified facial cosmetic surgeon. My practice is in central London on Harley Street, and I specialize in only facial procedures. So when it comes to facelift surgery, neck lift surgery, what is natural? What is the recovery? What are the risks? Well, one helpful tool that I have in order to guide me in terms of facial aging is looking at old photographs. So with my patients, I really encourage them to show me old photographs of how their face used to look. And a common thing that I see is, well, often in youth, we have this kind of V-shaped jawline and more volume in the cheek area. But key is to look at this detail, because we can see even this lady who's now in her 60s, well, she always had these nasolabial folds. And so, yes, they have changed with time, but they were always there. And yes, there's this kind of hooding and shadowing around her eyes, and they look like tired in appearance. But even in these older photographs, she had lower eyebrows and only a short distance between her eyelid and her eyebrow. And so key with natural looking surgery is we preserve these key attributes because they're unique to every individual. Some people see a lot more eyelid and there's a lot more eyelid show, and that can be helpful to look at these old photographs to really see how these things have changed. Because what is natural is individual for each individual person. Now with facial aging, what we can see is the effects of gravity. Like this area of the face, well, it comes down. And what that results is increased fullness along the jawline. The jawline gets squarer. Now sometimes increased volume is called jowls. And of course, some of that volume also results in increased fullness in the neck. And that's associated with this change in the neck and fullness in the neck. And so the face changes from a V-shaped jawline, which is kind of attractive and youthful, to a squarer jawline with gravity. But how each individual person ages is unique to them. So key is to look at how this has changed. The commonest facelift kind of surgery has been SMAS facelift surgery. And SMAS facelift surgery is really focused in this area of the face, and it really means tightening in that direction of this blue arrow. And this definitely improves this area of the face. However, it doesn't affect the neck in significant detail, and it does nothing for these kind of folds, because in a way that's related to the vertical change with aging in this direction. However, that facelift surgery is easy to conduct. It tends to be relatively fast, and it will give an improvement, but perhaps not quite as natural and quite as long lasting as lifting this area. My preference, and this is really from 10 years of experience in doing different types of facelift surgery, is vertical deep plane face lifting will lift this area of anatomy back where it used to be. And that's really lifting upwards in a vertical direction. And that will also improve the neck area because that area is also lifted. And so this is an illustration from my book, and what we can see here is by lifting this area upwards, well, we're essentially restoring the anatomy to where it used to be. So it's very natural in terms of the result. And by doing this, well, we can also hide most of the facelift scars and incisions in natural curves in the ears, which is also very helpful. Ideally, we don't want scars extending in front of the hairline or below the ear, because that can be more visible afterwards. And so with vertical deep plane facelifting, by lifting the underlying anatomy, which has dropped with gravity, the skin and hiding the scars becomes much more straightforward. However, in terms of lifting this area of the anatomy, it requires quite in detailed and depth knowledge of this anatomy, because in this area there's also facial nerves and there's important structures of anatomy that we really must preserve. So most facelift surgeons, well, particularly if they're doing more body surgery, they may just do smash surgery, favoring surgery in front of the ear, which does make a difference. However, when we're looking for purely natural results and lifting things in terms of anatomy to create that more V-shaped jawline, well, really we want to lift in a more vertical upward direction. So this is one of my patients. In terms of a vertical deep plane facelift, we can see her jawline is more V-shaped. We can see that it's softened, this kind of curves and folds around her lips, the nasolabial folds and marionette lines are softened. However, it looks natural. And this is only like weeks after the surgery. And then with her eyes, well, you can see a clean eyelid where there was this shadowing beforehand. And I did revision eyelid surgery for her, revision blepharoplasty, that just opened up the airway. However, I used her old photograph really to guide me in this area, because we didn't want to open the eyelids up too much, as that can truly change someone's appearance. The key is to preserve that natural appearance and not change things. Now, in terms from the side view, well, we can see what's happened to her neck. Well, her neck previously started where her chin was, but now by vertically lifting everything upwards, it's softened the nasolabial line, it's softened the marionette line, and it's improved the natural shape of her neck. Of course, it is possible to do even more in certain areas. However, in a way, we want to keep this a natural curve, and few people have kind of a straight angle between their jaw and the neck. So key is looking at what each individual person had before and preserving that. From the side 3/4 view, well, we can see her jawline was softened, there was jowls before, there's changes in the neck, and lines and shadows in this area, and afterwards everything is lifted that bit higher up, and so everything is smoothened and made more even. The scars, well, the scars are largely hidden in the natural creases underlying the hair, behind the tragus part of the ear and right behind the ear, making these scars very difficult to see even weeks after surgery. Now, often the detail is really important. Volume loss really can be replaced with your own fat transfer. So that means taking a small amount of fat, usually from around the belly button, sometimes from elsewhere if you're particularly thin or you've had other procedures, and it means concentrating that fat and putting small amounts of fat in specific areas. In areas under the eye, in areas of shadows around the face, around the temples. Now, that doesn't create large changes, it creates more conservative changes. So even on a high definition photograph, those changes are quite conservative and discreet, because we're really looking for subtle millimeter changes. We're not looking for large changes. The face changes by millimeters, and so every millimeter is important. I mentioned to you revision blepharoplasty. Well, we've just cleaned up the appearance around our eyes and the lower eyelids, including fat transfer. And then the final thing is using a laser that just polishes the superficial layer of the skin, stimulates collagen, improves fine lines, sun damage, enlarged pores. And again, it's not radical changes, it's just looking to fine tune and fine balance those changes. And now from the other 3/4 angle, where we can see clean eyelids, where the eyelids looks refreshed, we can see a clean jawline and neck. However, the scars are discreet and hidden, and it looks natural. Under the neck area, well, in the past, surgery has done to really tighten this area, and lots of stitching was done all the way down the neck. However, that did create a lot of tightness in the recovery period. And so my preference now really is to focus on lifting everything with deep vertical plane lifting, and really just to tighten a little bit in this area, in the corset area. However, most of the neck remains unstitched, and what that does is it avoids feelings of tightness. Most of that came about by doing a lot of stitching in the neck area, which in my opinion is not necessary if everything is lifted nicely. So in summary, in terms of facial aging, well, the two most important areas in this patient was really around the changes in her neck and jawline and around her eye area. Less is definitely more in terms of keeping things natural. A little bit of fat transfer, a little bit of laser resurfacing polishes these areas. However, it doesn't change things too much. It's really a combination of facial aging of loose skin, gravity, and loss of volume. And the two most important areas, definitely the eyes and the neck area. My personal approach is a signature vertical deep plane facelift because that's natural, it's long lasting. Yes, it requires meticulous technique and knowledge of the underlying anatomy, but the detail is so important in terms of facial aging. Everything in your face is millimeters and less is more. Small amounts of fat transfer keep things looking natural and preserve things for longer. I do have a facelift score app that can really help people guide you. Are you ready for a face or neck lift? And this contains information that you should really know before having surgery, how to avoid certain risks and complications, what's important in terms of healing and recovery, and it takes only a few minutes to complete. I do hope this has been helpful for you. If you have any questions or any thoughts on this, please don't hesitate to contact me. Thank you.